So posterior capsule opacification. I don't really think it's a complication of cataract surgery, but actually something that happens not infrequently after cataract surgery. When we take the cataract out or the lens out, it's surrounded by a clear, effectively a cellophane bag called the capsule. We tear a hole in the front of that to gain access to the lens itself, and then we eat away the cataract, and that leaves the clear bag in place. We slide the new lens back into that clear bag, it springs out and holds itself in place. But that clear bag itself goes cloudy in about a third of people who have ordinary cataract surgery. What happens is there are residual cells that sit within the bag which we can't get rid of, and they start growing again, trying to reform the lens, but they can't do. So that clear bag behind the lens, they grow across and become cloudy. And then you effectively get the vision blurring again, you get the glare again. It's not the cataract coming back per se, because once the cataract's gone, it can never come back. But this filmic membrane is literally like frosted glass or tissue paper behind the lens. It will get worse with the passage of time. If it's minor, we leave it alone, but if it's causing you problems, we can easily zap it away with some laser treatment. The laser treatment is called a YAG laser. You sit out the slit lamp, which is what your ophthalmologist examines you on. We pop a little contact lens on the eye, zap, 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 about a 3 or 4 minute job. It's not very exciting stuff. So we clear it away, and then it never ever comes back again. There are problems with everything we do to you. You can get a bit of inflammation, a bit of pressure. You can get pits in the lens. They're usually visually insignificant. You will see a floaty bit, because actually that little bit that we zap away sits there for a little while and disappears gradually. So for a couple of weeks you may see a little floaty bit. Really, really rarely, because we create a little concussion wave inside the eye, it can cause retinal problems. So if you develop flashing lights or floaters or solid curtain across your peripheral vision, you must report it straight away. Posterior capsule opacification is, as I said, quite common, and it's not a problem. Typically occurs 1 to 2 years afterwards. There are some people who develop it earlier, and that is because their cells are pretty active, or their cataract was actually involving the clear bag, something called a posterior plaque. We try and polish it away, but we can't take away that bag, because that will lose support for the lens that we put in. So we leave it in place, and it can go cloudy earlier. And if you're younger, you tend to get a bit of clouding earlier, but it's easily sorted out with some laser treatment. It's available either privately or on the NHS, and it's virtually a normal occurrence, normal sequelae of cataract surgery.